my name's Jane. I'm one of the lecturers at Plymouth University at Peninsula Dental School. And I just want to talk a little bit about how we've used 3D printing in our simulation labs for the dental students. So this is our simulated dental learning environment at Plymouth. And hopefully you can see that. As you can see, it's quite a large lab. It's got about 60 chairs of simulated dental chairs. And on those chairs, you've got a lamp, a bracket table, drills, suction, foot pedals, everything you'd expect from a dental chair in practice, except instead of having a real patient, you have what's called a phantom head. And the picture at the bottom there is one of our professors just trialing out a new procedure. And these phantom heads, they're basically like quite high-tech crash test dummies. It's like half a torso. You can lie them back on the dental chair. They've got a plastic head and some quite stretchy rubber cheeks. And basically what we do is we put different jaws and different teeth inside these phantom heads for our students to practice on. And they practice all their procedures first on these models before they go on to real patients. So when I went to dental school about 20 years ago, what we used to do, we didn't have anything so high-tech. We used to go to our local dentist and ask them whenever they took out a tooth to collect them for us and put them in a jam jar. And we used to end up with that picture on the left, which is basically jam jars full of extracted teeth, which we'd go and pick up, and then we'd take them back to a university, sat on our National Express coach with a jar of teeth in our bag, which is quite weird now that I look back on it. But we used to set them up in plaster of Paris and clamp them to a workbench, and we would just practice drilling and filling on these real teeth. Now, that had a lot of benefits. Obviously, it was realistic because it is real teeth. However, there was some drawbacks from it. Basically, you got what you were given, so there was often a shortage of teeth. People get their front teeth taken out less than their back teeth, so you often wouldn't have front teeth to practice on. Also, teeth are often taken out because they're so decayed they can't be filled. And so we were often trying to fill teeth that couldn't be filled. And also from a teaching point of view, everyone was doing a different procedure, so we were all working on different teeth, and it was quite hard for the teacher to know who was struggling and who was doing well. The other problem with real teeth is that it's quite hard to use them now. So we're quite a modern dental school. We're only 10 years old, and we're not set up to use real teeth. There is a very, very small risk of infection from using real teeth, and so we have to treat them as clinical waste. We can't just throw them in a normal bin. We'd have to dispose of them as clinical waste, and that's very expensive. And also, because of the Human Tissue Act now, we have to get consent from all the patients if we extract their teeth to use it for teaching or research. So again, that limits what teeth we can use if we haven't got any consent. So what we use is, at the moment, is the picture on the right, which is the phantom head jaws. And these are plastic jaws that have pink rubber gums over them and plastic teeth, white plastic teeth. The benefits of this is that there's an easy supply of these teeth. We just order them, and all the students get the same teeth. We can replace them as needed. But the downside of it is that they don't have any of the realistic features that the real teeth have. So we started thinking about how we could maybe combine the pros of both these different approaches to make something that was more realistic for our students. So we started to think that maybe 3D printing could offer us a solution. We know that from our previous speaker and from today that 3D printing is really quite established now in clinical dentistry. You can use it for lab models, surgical splints, dentures, and it's also used in MaxFax for the custom-made implants. So for example, this is a custom-made titanium implant of a mandible, of a lower jaw. And in the past, that maybe would have been done with a bone transplant of a rib, but they've used a custom-made implant. So 3D printing lends itself quite well to dentistry because we're making small numbers or one-off items, and they're quite small items, so they can print quite quickly. And we know that 3D printing had been used in other areas of medical education, commonly in cardiology. For cardiac surgery, they were printing out models of hearts from their scans, using them for patient education and surgical planning. And this is also an example of a model called Baby Martin, which was designed in collaboration with the Royal College of Surgeons. This was a neurosurgeon who was aware that his trainees weren't getting enough practice of pediatric neurosurgery. Surgeons often practice on cadavers, and obviously there's a shortage of certain of pediatric practicing, so they needed to make a model that they could practice these procedures and build up their experience. And so they used 3D printing to create a pediatric skull for them to practice on. So we started to think that this could be something we could use. So the project that we started off with was what's called occlusal caries removal. So those of you who aren't dentists, occlusal is just the biting surface of the back teeth, and caries is just a posh word for decay. And our current simulation teeth are these white plastic teeth that we'd actually modified. So you can see that we've used just black felt tip pen just to draw on early decay on one of the teeth. And in the other tooth, we've drilled a hole in it and we've put wood filler in, which is to simulate the decay, and then our students actually practice drilling that out. It actually works quite well considering how basic it is, but we wanted to do something a bit better. And these current simulation teeth, they didn't have any internal structures. So a real tooth has enamel, dentine, pulp layers, and the real decay. These teeth that we're preparing, because we're preparing them by hand, they can be variable, and people can get a different learning experience. And also they're not necessarily reproducible, which in an exam situation, if we're testing our students before they go on to patients, we want everyone to sit the same exam. So the other thing is, because we've got about 60 to 70 students in a year, and they're going to get through at least 10, 20, if not more of these teeth a year, it's really time consuming to try and prepare all these teeth. So the picture on the left there, that is a real tooth, a section of a real tooth with decay. And you can see the different layers in it. It's got the outer enamel, underneath, which is the sort of bluish hard surface on the outside. Under that you've got dentine. That sort of orangey brown in the middle is the decay. And you can see it's got a very distinctive shape to it, which is that the hole in the enamel is quite small, but the decay has spread out quite wide in the dentine. And that's a really important concept for our students to grasp. So some of you, if you've ever had tooth decay, you might have found the tooth's just got a small hole in it, or it looks quite normal, and then you're eating one day and all of a sudden the tooth completely collapses. And that's because the enamel can stay intact for quite a long time, but underneath the decay is actually quite large. So we wanted to try and recreate that shape as well, because that's a really important thing for our students to understand. And then the picture on the right of the screen is what we have of the cross-section of the current teeth. So you can see we have managed to get the shape roughly. It is bigger at the bottom than at the top, but it's certainly not the correct shape completely, and it's also not got those layers in. So there's no enamel, dentine or pulp, which again is really important for landmarks for our students to know when they should be using different burrs or when they should be stopping drilling. So basically it's for helping them understand the concepts. So the aims of this project, we wanted to make more realistic simulation teeth. We want to make teeth which is easier to explain the concepts of decay removal in the teaching session. We wanted to make maybe cheaper teeth. We want to make them reproducible for assessment so that everyone's sitting the same exam, which is fairer. And we want to make teeth that are bespoke to our exercise aims. So at the moment we're buying mass-produced teeth and we're trying to fit our teaching and adapt them for our teaching. And actually we want to make models that are made for us, not something off the shelf that we have to adapt. So this is what we came up with, and we designed this using CAD, but there's lots of different ways you could get a model of a tooth with internal structures. The previous speaker was talking about cone beam CT as one of them, but we chose to use CAD because we wanted to add some details, and we were very specific about what we wanted in terms of the size and extent of the decay. So again, you can see the real tooth on the left, and you can see on the right, we've designed a tooth that's got an enamel layer, a dentine layer, it's got a pulp, which is the nerves and blood vessels down at the bottom, and it's got a decay layer, decay lesion in it as well. And it's even got an outline around the decay, which is what we would call hard but stained, which is a special area of the decay, which we need our students to understand, because they use that as a guidance as to where they should stop drilling and for the design of the cavity. And you'll see as well, we've put the measurements on, so we know exactly what size of the cavity is when the students start working on it, and what roughly they should end up with when they've finished. And this is our finished model. So it was printed using one of the Stratasys printers, the very, very expensive ones, the multi-material. And you can see that we've a real tooth on the right there, and you can see how they compare. It's already looking much more realistic. It's got, the decay looks more realistic. It's got an enamel area to it. It's got dentine of a different color. The decay, the pulp, the dentine, the enamel are all different colors and different consistencies, which is very important. And so we're really pleased with how this has turned out. So those new teeth, the benefits of them are they've got realistic layers. They've got all the anatomy of a real tooth. The caries is very realistic. It acts like real caries. You can use a slow burr on it. It acts like real caries. You can scrape at it with dental instruments. When you get to the edge of the decay, it actually hardens up and feels like you've reached the edge of the decay. It's reproducible, so each student has an identical resource, which when they're learning for the first time, it's really important that we know that they're all starting from the same place, so we can see which of them are struggling, which of them have made the cavity too big, which of them are doing well. And that helps if we start off at this baseline that is standardized for everyone. There's no further adjustment needed by the technicians. So with the other teeth, when we get the standard plastic teeth, our technicians have to drill all those holes and put the fake decay into them. They don't have to do that anymore, so that's saving us a lot of time. We've made them so they're compatible with our current phantom head system, and we haven't had to invest or design our own jaws to hold these teeth. And they're bespoke for our lesson plan, so we've designed the measurements to match in with what we want to teach. I've put at the end, they can be produced in smallish numbers at low cost. They're certainly not as cheap as the standardized teeth that we were using before, the mass-produced teeth. They're about 2 to 3 times more expensive. Now, there are other teeth that are sort of mass-produced that have got different layers in out there, but they tend to be about 5 up to about 8 times as expensive as the standardized teeth that we're using. So although they're more expensive than the teeth we are using currently, they're a lot less than all the other available teeth that are out there. And we can produce them in sort of hundreds, 200s, which is the kind of amounts we need, and we can change them each year if we want to change the exam or change the exercise. And I would say that overall, the time saving and the benefits of the realism probably are worth that extra cost. So we've done a small trial with the students. I'm not going to read all this out, but they really love them. They love the fact that they've got landmarks to work to. It does help them understand the concepts. They love the fact that they're 3D printed. They think that's great. And they really think that the caries particularly is very realistic, which is really good for us because that's something that they do need to understand the difference between the hard tooth substance and the decayed tooth substance before they go to start working on real patients. There was some limitations, so the enamel part of the tooth is a bit soft. If you think about it, enamel is the hardest substance in the human body, so there's no plastics out there that could be 3D printed that's really going to be as hard as that. And the plastics that were available on this printer weren't as hard as that. However, the dentine, the pulp, the decay are all very realistic. So I'm willing to accept that the enamel isn't quite there yet, and perhaps there's different materials or different methods that we can look into to change that. There was some comments about the design. Some people felt that the design of the tooth should be different, but I don't really see that as a limitation. In fact, that's the beauty of the 3D printing, is that we can make lots of iterations of the tooth. We can change it. If a lecturer wants to make it a different shape for their teaching, then it's easy to do that. And so that's the beauty of this. I don't see that as a limitation. The design is very easily changed. The students, they did like it, but one of them did comment that the original plastic teeth that we're using did have a smoother surface, and obviously real teeth have quite a smooth surface. And I think it's just the nature of 3D printing, because things are laid down in layers or in little dots, that you are going to always have that layered effect to it to some extent. However, again, I think overall the finish was pretty good, and it does look really good. I think the benefits are still outweighing the cons. So that was our main project. I just want to talk quickly about 2 other projects that we've used 3D printing for. This is a composite build-up exercise that we do. So The picture at the bottom there is someone that's got tooth wear. So that's someone who's perhaps ground their teeth and their teeth have started to wear down a little bit. And and that's one of our patients there on the left in the phantom headroom, and you can see that they also have tooth wear. And what our students do is they practice building up these teeth using white fillings, white composite fillings. Now, previously what we were doing was buying the white blanks, the plastic teeth, cutting them down, which was time consuming for the technicians. Again, there was quite a level of variability in that. And it was quite wasteful. If you think about trying to introduce sustainability into your practice, to buy something and then immediately cut it in half and throw half of it away, it doesn't make sense. So this was actually done on a foam printer. So we're actually at the other end of the spectrum now, from the most expensive printer to one that's quite affordable. And we printed out these teeth. We took the front 6 teeth and we actually modeled them so they were already worn and printed those teeth out to fit in the phantom head. And this saves a lot of time and also saves waste from throwing away teeth or just buying new teeth and drilling them. The beauty of this is that the composite fillings that we use to build up the teeth are light cured resins, but just with fillers in. So they actually bond really well to other light cured resins, and it gives a really quite a realistic effect. Sometimes when you're bonding these, when the students are practicing and they're bonding the white fillings to the plastic teeth, they don't really bond very well and the fillings tend to fall off. But they actually bond really well to other light cured resins. So you get quite a good finish with this, and it's worked out quite well as an exercise. I guess again, the only problem is this resin is quite soft, but I think looking on the plus side of that, that means that our students have to be extra careful when they're polishing the teeth so they don't wear them down. And I think we would prefer our students to be extra cautious with the use of the drill or polishing than the other way. So it actually makes them be more cautious when they go on to real patients. And then finally, we have this model, which is what's occlusal restoration. So this is when they're practicing placing fillings in back teeth. And again, what we used to do with this is buy the white blank teeth, drill a hole in it, and then they would practice filling it. And again, this was really time consuming for our technicians. So it would, they'd be spending hours and hours drilling these holes for the students to just put fillings in, which would then have to be drilled out again. We ended up with lots of holes in the teeth which perhaps weren't the right size or shape. There was a lot of variability. And again, in exam conditions, when we're testing our students on placing restorations, we want them all to sit the same exercise. So again, we 3D printed a tooth with known dimensions of a cavity and got them to fill it. This one is printed, again, I think on a Stratasys printer, but it was one of their models that was designed for use in clinical dentistry. And as a consumer, I think this is what I've learned, is that every time I've done a project, I've used a different material or a different printer. And I don't know yet which printer we would end up using the most. It's something that's going to become sort of more obvious to us with time. But there's no printer out there that does everything. And I think my experience has taught me that if we're going to get the most out of the 3D printers, it's really important to think of the application and what is most important. So for the first project, it was really important to have the different layers, and that could only be done on the one printer. Actually, for the second project, the composite build-up, it was really important to have a smooth finish, and that's why we chose the foam printer. So there's nothing out there that does absolutely everything. In terms of the future, the brilliant thing about 3D printing is that it integrates so well with the other 3D technologies that we're developing. The main one, I would say, is Haptics. So we are getting a haptic machine at Plymouth later this year. And what you can do with the haptic machines, if you haven't come across Haptics before, it's basically like a virtual reality with feedback. So it's taken from, it started in the aerospace industry, I think, and you basically have a virtual reality tooth and a real handpiece. And when you drill the virtual reality tooth, you actually get feedback on the handpiece as if you're drilling a real tooth. So it's a way for students to practice again and again, but without actually using up the resource of the plastic teeth. However, there are some things that can't be done on the haptic machines, and that's where the phantom heads come in. So we can take our 3D models, upload them to the haptic machine, they can practice on the haptic machine, we can then 3D print those models, and they can practice them on the phantom heads. So it just gives them another option to practice. We can also take our 3D models, and we're doing developing work with things like the HoloLens at the moment for augmented reality and virtual reality. And any of the models that we're using, we can upload to use in that. And augmented reality in particular is quite useful. You can project the teeth, perhaps the model of the tooth at the start, and then after they've drilled it, you can project the tooth from the start onto what they've drilled, and they can see what's changed. So it's quite good to see what they've taken away. And I think that both augmented reality, whilst they're kind of in very early stages, they will get there, and they fit really well again with the 3D printing. And I think where we'd like to go eventually, and I know other dental schools are looking at this as well, is the pre-surgical planning for students. So it would be great if our students can scan their patient's teeth, upload that to the haptic machine, have a go on it, practice the procedure haptically, then 3D print the models, put those models into the phantom heads, practice them again, and then when they're happy, go and do it for real on their patients. And every time they do it, they can get feedback, changes, how to make improvements from their tutors. So it's basically, you know, we're quite, in surgery and dentistry, we're not good. You take more practice swings hitting a golf ball probably than you would practicing before you drill someone's tooth. And so I think this is an area that we'd like to develop more, particularly for our students, because they find it really useful to get the feedback. So that's everything. It was just an overview summary of how we've used 3D printing at Peninsula Dental School. If anyone has any questions, I will be around here for about 5-10 minutes afterwards. But you can also find me on Peninsula Dental School website, just under the staff list. Please email me if you've got any questions, ideas for collaborations, or just if you want to have a chat about what we've done and you get any advice, then please get in touch. But thank you for listening. Thank you.